Depression is the leading mental health ailment amongst Kenyans, according to the Kenya Human Rights Commission.
True that for every 4 Kenyans, one suffers from mental health, a complication that can result to early death if interventions are not taken.
That is always dismissed as normal. But what many fail to know is that depression is now one of the fastest killer diseases, not only in Kenya, but worldwide.
I felt tired, I felt frustrated, I felt like I was battling too much. But if you asked me what really I was battling, I wouldn't have an answer for you.
Depression. What is it? And what's the difference between feeling depressed and experiencing depression? For many people, feeling depressed can mean feeling sad, unhappy, or low. These are natural and normal feelings, even if they arrive without any warning or reason. Generally, these feelings will go away with time. Your mood will lift, and you'll start to feel better. However, if you are sad and unmotivated for 2 weeks or longer, stop enjoying the things that usually make you happy, withdraw from friends and family, or feel empty or numb, it might be a sign that you're experiencing depression. So, what exactly causes depression? There's no simple answer. Depression affects everyone differently. It's also caused by many different things. Often, it can be the result of many unique factors. Common ones include being in ongoing stressful situations, undergoing a big life change, having a family history of depression, experiencing grief or loss, going through ongoing physical illness or pain. You may even be at greater risk of depression due to your personality traits, especially if they include worrying a lot or being overly critical of yourself. Depression is more than just feeling depressed from time to time, but it's important to know that it is treatable, and it's worth reaching out and talking to someone about.
To understand the root cause of depression, one must investigate their lifestyle choices, see what they've been doing recently, check their diet, stuff like that. Be keen on what issues they're going through and how they're being handled, and if they're being supported to take care of those issues. It's also important to know the family history. The techniques vary depending on the individual, as therapy is very personalized. However, cognitive behavioral therapy is the most recommended. This is where the therapist asks the individual a couple of questions, and then the individual is expected to answer them while questioning their beliefs and why they think the way that they do. It is the most effective as the individual plays a huge part. So for therapy generally, it is recommended that one has 10 sessions, each of 3 hours, but depending on the severity of the case. But the minimum number of therapy sessions should be 10. But sasa, it's impossible to know how long it will go, because again, it is all very individualized. As for the milestones one will achieve, that would have to be dependent on what the client communicates first, and the goals that the client and the therapist set on the first session. So they work on that. So a few sessions to talk about the problem, to bring it to the surface, and then follow-up therapy for the therapy to follow up on whether or not the client is coping. So depending on the therapist's level of qualification, because it's not just any person who does therapy can even diagnose someone with any mental issue. That is for the psychiatrists. So the therapist is supposed to, for example, like myself, I'm not able to diagnose a person, so I'm supposed to refer my client to someone else who will then run them through the whole thing and come up with a accurate and conclusive diagnosis, and then they are in some cases prescribed drugs. But this is not always the case. It's not all cases that actually require that. So yeah, depression is heavily personalized, so there isn't really a blanket way of just addressing the whole thing. So it's just important to work towards prevention if possible. Frequent checking in with yourself. Because normally depression will be some kind of issue that one is experiencing that is not being handled in any way. So it's piling and piling and piling. And also to seek out help from people who are around you. Talk to people, express yourself, take good care of your body, take good care of your mind, the things that you are consuming, and speak up as early as possible. That is what I would recommend.